The Health Secretary, Matt Hancock, has told pharmaceutical firms to stockpile an additional 6 weeks' supply of medicines to prevent disruption in the event of no deal. The UK would continue to accept new medicines that have been tested in the EU. More details from our health editor, Hugh Pym.
The concern in some parts of the NHS and the pharmaceutical industry is what might happen in a no-deal scenario if supply lines for medicines are disrupted. In the event of lorries getting stuck at Calais and Dover because of customs delays, vital drugs needed by patients like insulin might be held up. The Health and Social Care Secretary has now written to NHS and social care organisations saying there's no need for hospitals, GPs and pharmacies to stockpile medicines or for doctors to write longer-dated prescriptions. He says pharmaceutical companies should build up an extra 6 weeks of supplies of medicines imported from the EU to avoid any possible disruption. To that end, he's written to the firms asking them to clarify their plans to do so. The Chief Executive of the NHS Confederation, Niall Dickson, welcomed the guidance but said more detail was needed.
The government has recognised that they can hope for the best, but they've got to plan for the worst. And this is a welcome first step. It does show that the government recognises that there is a danger, if there isn't proper planning, to make sure that patients get the medicines and the treatment they need when the UK leaves the European Union.
The pharmaceutical industry is pleased the government will allow drugs and devices tested elsewhere in the EU to be used in the UK. But some say the need for the British regulator to approve new medicines in the UK, if there's no deal with European regulators, will add an unwelcome layer of bureaucracy for life science companies.